can't bear the cost of patients suffering from COVID-19, said it was untenable during a pandemic. Where does that leave Kenyans? It's a discussion we'll be having right here on the show as well. We love it when you're part of it. Once again, you can get me at I am Jeff Mote or at K24 TV. Before we get to Dr. Camuno right here, let's look at the front pages of your dailies, see what you're waking up to this morning. Starting off with the front page of the People Daily. Staring at a health crisis. They say 10 doctors have succumbed to COVID, and with hundreds others infected, medics have now given a strike notice that if they are not protected at work, they will down their tools, making a bad situation even worse. That's a story that you can get on page 8 of your People Daily. The details of that therein. 70,245 cases right now in terms of the cumulative caseload right across the country at this particular point in time, and just the medical fraternity trying to come to grasp with losing some of their own and demanding the proper tools needed to actually go out there and work at the front line. Once again, that story on page 8 of your People Daily this morning. Also on the front page of the PD, MPs want BBI changed, but Raila says no. Given their central role in making laws that are proposed in the Building Bridges initiative, legislators say some recommendations defeat the purpose of reviewing the Constitution. Once again, as you can see, this particular document is not getting the required consensus it should get, even as it moves forward on that. But today, ostensibly, is day one of them getting 1 million signatures to move this process forward. We'll be having that discussion right here on the show as well. But that story is in your copy of the People Daily on page 4 and 5 therein. Also, front page of the PD, senators demand CS Magoha kicked out. Of course, this after the video that went viral of him making some derogatory remarks to a certain education official. They demanded an apology for that as well. But this story is on page 2 of your People Daily therein. You can find the details right there. And as you can see, Lewis Hamilton just becoming racing royalty any way you look at it. 7th heaven for Lewis Hamilton as he breaks the record in terms of victories so far. You can get that story on page 30 of your People Daily this morning. So those are some of the stories you're waking up to as far as your People Daily is concerned. The beauty about the People Daily is you can get it straight to your phone. The number that you dial is star 550 star 4 hash. Once again, the number is star 550 star 4 hash. Dial it and get yourself a copy of your PD straight to your phone. It's brought to you by the People Daily and Safaricom. Now the front page of the Daily Nation revealed scandal of 500,000 quote-unquote ghost pupils. Taxpayers have been losing billions of shillings every year after head teachers and corrupt education officials seeking to line their own pockets inflated enrollment numbers used by government to disburse funds for the free primary education program. This is on page 7 of your Daily Nation. Magoha says anomaly was unmasked by task force on the new school curriculum. That story is on page 7 of your Daily Nation. You can get the details of that therein. And even as you look at that, Matungu MP's last moments, going through those last moments of Honorable Justice Murunga the late, of course, passing on at that particular point in time. You can get that on page 3 of your Daily Nation therein. And as you look at that, of course, Black November, the Daily Nation is calling it, as COVID deaths spike. More than 270 people have died in 2 weeks. Of course, if now wasn't the time to follow these particular protocols, this definitely paints a very vivid picture as to why you need to follow the Ministry of Health protocols in terms of keeping that social distance, wearing your mask, sanitizing, washing your hands, because this really is the difference between life and death. And that story is on page 12 of your Daily Nation this morning. Also in the Daily Nation, in BBI referendum contest, it is 2010 all over again. Raila tells those opposing reform push to join the no camp. And as they say, this is very reminiscent of the last time we had a referendum, when it was all about the bananas and oranges, and it seems like that particular ghost is back for this particular event. And you can get that story on page 5 of your Daily Nation. We move it along to the front page of the Standard now. BBI signature tune, meet us at the ballot. In the clearest signal yet that Kenya is now headed for a contested referendum, Raila, accompanied by CS Matiang'i and Wamalwa, meet Western governors and declare that collection of signatures starts this week. But Ruto's allies decry a quote-unquote rushed BBI process. That story is on page 6 of your Standard therein. But even as you look at this particular issue in terms of rolling out the process as far as signature collection is concerned, alarm as neglected medics call for strike. Left to fight a killer pandemic without adequate PPE and compensation, doctors, nurses and clinicians give strike notice. This during a pandemic, really turning this situation from bad to worse. And you can find it on page 8 of your Standard this morning. Fees dilemma as CS calls talks on school calendar. Stakeholders to confront challenge of new dates, compressing 2020 and 2021 lessons. And of course, that grey cloud hanging over every parent's head in terms of school fees. You can find that story on page 2 of your Standard this morning. The details of that in there. Move it right along to the front page of the Star now. They're all about matters referendum. MPs demands on Uhuru. Legislators have also rejected the election of 2 Senate reps, man and woman per county. Lawmakers have opposed task force proposal to elect 47 women senators and in this particular report that was forwarded. So as every legislator, every stakeholder puts forward their demands, what will they accept? What will they reject? As I said before, as far as the report is concerned, they're only making editorial changes. How far do those editorial changes go? Well, this is something that we'll see play out, and you can get the details of that particular story in your copy of your Star. Finally, from page of the Business Daily, SportPesa faces 30 billion shilling money laundering probe. A financial reporting center seeks to know if betting billions were declared to the gaming regulator. That's a story that you can find on page 4 and is also the lead story in your copy of your Business Daily therein. But even as you look at the numbers as far as that's concerned, they're also talking about the COVID-19 distancing headache. Thousands throng the ever-busy Kamukunji market, extending into the neighboring Gikomba yesterday. Distancing is one of the headaches Kenyans face as COVID-19 cases keep rising across the country. Yesterday, 972 new cases were reported, raising the total tally to 70,245. How do they manage to continue with business as usual, even in these COVID times, is a key question being asked by the Business Daily, and you can get all the details therein. So that's what you're waking up to as far as your dailies are concerned this morning. But also, we have a discussion with NHIF CEO Dr. Peter Camuno, discussing NHIF and the Big Four agenda, especially during times of a pandemic that is coming up right here. Welcome aboard. And welcome back. In case you have any questions as far as your NHIF is concerned, please feel free to chime in on the conversation. The WhatsApp number is at the bottom of the screen. You can also get me on Twitter at @IamJeffMote or at K24TV. Taking us through this particular discussion, we'll have the CEO of NHIF, Dr. Peter Camuno. Good morning, Dr. Peter.
Good morning, Jeff. How are you?
Very well. Karibu and welcome to the show.
Thank you very much. Always a pleasure to be here.
Asante sana. I just wanted to jump right straight into this particular conversation because as it stands right now, the country is still reeling from the statement made by CS Kagwe in terms of this particular pandemic and the fact that the government rather couldn't bear this cost, said it was untenable both for the national insurance and private insurance companies. Please shed light on this because many Kenyans are seeing that the one time the national insurer should have stepped up, they've been left to their own devices. They've been abandoned, so to speak.
Well, thank you very much, Jeff, for that question. And, you know, I think the first step we should take is to understand the full scenario. First of all, I think it's good that we appreciate that the government is actually doing a lot in terms of supporting Kenyans during these times of COVID, in terms of support from the national government, support even to the counties to ensure that there is increased capacity, there's adequate human resource with adequate protection and even the facilities. So I think, first of all, let's appreciate that. Then to get to the question, you know, it's good that first we understand that what is a pandemic. And I'm sure you know that around 11th of March, when WHO declared COVID-19 a pandemic, it has far-reaching effects because a pandemic is a condition that you know is global, has global spread, and the big challenge that we have, especially now when we look at us as an insurer, is that we do not know the extent that it will go to. We do not know the number of people that it's going to infect. We don't know the duration that it is going to take. And then, especially for COVID-19 being a novel virus, even the management of it is something that we are learning on the go. So when you have a scenario like that, and when you have a pandemic, it is the whole government approach towards it, and that is what has been happening. But circling back to the specific question that you've asked about NHIF, and like you said, it's an insurance. And if you look at what are the concepts of insurance, is that there is a payment of a premium for a certain defined set of benefits. Now, in as much as we are in a position to assist as much as we can, with the current funding, we cannot support COVID management. And because specifically pandemics are an exclusion in our contracts. And it's not because we do not have the capacity to take care of that, but it's because the funding for it is not there. But that doesn't mean that we cannot get funding to be able to be a vehicle to support. And that is what we are working on at the moment. But I think it is good that we appreciate that the government is doing a lot to support the people of Kenya. And if you look at even the facilities following the president's directive that the counties have at least 300 beds to be able to manage the patients within the counties, is something that is in the wake of that. And I know you might also say that, hospitals are being overwhelmed. But if you look at the public hospitals, only at about 25% occupancy. So I think it's something that we need to work together and look at the context to see what is it that we can do to be able to support the people of Kenya in this novel virus known as COVID-19.
Okay, and let's just dig a bit deeper into that, because as is with President Kenyatta's government, universal health coverage was a key pillar in his Big Four agenda, and the NHIF was a key driver in terms of actually bringing this to fruition. At this particular point in time, Kenyans really skeptical. Is this working? Is it not? The 4 pilot counties having their funding withdrawn, other counties saying that there's a lack of funding and direction on how this should move forward. And again, all the players in this being asked, really, is this working? We were thinking this would be the time UHC would have been godsend. Yet there are all of this double speak coming from the ministry.
All right. Jeff, I will circle back to, first of all, even defining what universal health coverage is. It is, in very simple terms, it is ensuring that all the people have access to the care they need without financial hardship. That is as simple as I can make it. And UHC is not an event. It's not like we decide that today we are having UHC. UHC is a journey, and we have been on that journey. I would say even for NHIF, from the time NHIF was established as a department in the Ministry of Health way back in 1966. And way back then, when it was established, it was to provide cover for government workers at that point. And then with time, as its success was being noted, the coverage was expanded to include voluntary contributors from 1972. Now, fast forward to 1998, when through an act of parliament, the NHIF Act was established, and were established as a state agency, a parastatal. And fast forward again to 2015, when we added outpatient benefits, because up until then we were only dealing with inpatient, and especially inpatient rebates, and that time it would cover most of the hospitalizations. But as we noticed the need increasing to be able to support our members to be able to access quality care and without any financial hardship, outpatient care was included in 2015. And since then, we have been improving this with different packages to include surgical packages, oncology or cancer packages, radiology or imaging packages, even cover for dependencies, maternity covers, and especially with other added support, even from government like Linda Mama and the health insurance subsidy programs for the elderly and the orphaned and vulnerable children. So we have been on this journey towards UHC. I know there was the UHC pilot counties, the 4 counties that was done, and that was also a slightly different model. That was what we call an input financing model, whereby the institutions there, the healthcare providers there, were financed to provide medication and the services, and people just walk in and get care and leave. So that is a different model. The model that we are now advancing is what we call output financing, or an insurance model, whereby the members, people who have been registered, go to the hospitals, and the hospitals submit claims that we pay as NHIF. Now, in terms of the packages, we have now and are now expanding with the essential benefits package to ensure, in addition to the comprehensive services that we have, also other benefits like primary care, preventive care are also going to be included. Now, in terms of coverage of members, as you know, NHIF is open to all. There are the statutory contributors, you and the folks who are employed, and then there are the voluntary or informal sector who must contribute voluntarily. However, many of them tend to default. And then once you have those ones in, there's a group that whom we would call vulnerable or indigents, who absolutely cannot afford. And the work now that even the government is doing is to identify who these individuals or families are, to be able to get support. And to kick off that scale-up of coverage, National Treasury has already put out enough funds to cover for 1 million households. And this now will continue. And as you know, in the country, the estimate is about 5 million vulnerable or indigent households. So that is our work to ensure that all the people who can are supported, and therefore we drive our way towards universal health coverage by having all the others who can pay their premiums to have this suite of benefits and therefore access to care without any financial impoverishment.
And with all of this that's going on, because we're pressed for time, we just want to move it forward, because even under the COVID cloud, we've also had, the making of COVID millionaires. We've had that happening. And with the department that you're heading, Dr. Camuno, 2014, there was an NHIF scandal. In 2018, I believe this year, the DCI sent a letter asking for some documents from the NHIF. As the man at the helm, because this is a reality of the post that you're holding, how are you planning on dealing with this amorphous group of people called cartels? Because anytime a scandal happens in a government office, it's always pointed at, they'll never say Peter or Jeff, they'll say it's the cartels. How are you planning on dealing with that so that you don't have a COVID millionaire situation emanating from the insurance fund?
Yeah, I really like that question, Jeff, and I'll tell you why. First of all, number one, with output financing model like what we run as NHIF, there is accountability and transparency 100%. And I'll tell you how that is. Because, Jeff, if you pay your premium of 6,000 shillings or your 1,700 shillings per month, because you're very well paid, your premium is accounted for and for a person. And when you go and get services, the services that you get at the hospital are paid for. So you can actually track each and every shilling, because we track each and every member. Because I'll tell you right now, as of end of last month, we had 9.6 million principal members who have ever been registered. That's about 22.5 million Kenyans in our database, but only about half of them were active, and we know that. And it's also good for you to know that of all the contributions that we get, about 90% of it goes back to pay our 8,189 providers across the whole country. So even as we scale up to have UHC there and using this output model financing, which is an insurance model financing, you'll be able to account for it. Now, indeed, we know that notion of cartels, etc. And I'll tell you from where I sit, where I see the biggest fraud. Actually, it is from basically claims which are not proper. You know, there is the issue of impersonation, whereby people use other people's cards to access care. We know about treatment that is exaggerated so that they can claim more from the hospitals, etc. And there is a lot of medical fraud that happens. And one of the things that we are doing to ensure we eliminate this, and I think it will also answer your question, is having digitization of all our operations. And as you saw about 2 weeks ago, when His Excellency, the President, Uhuru Kenyatta, launched our scale-up of UHC, whereby we were launching biometric registration, which we have been having, but now we're just scaling it up to ensure that the beneficiaries who are accessing services are the actual ones. And not only that, we are also doing electronic claims. So this will help us in several ways. Number one, it will increase efficiency and remove the challenge of delays in payment to our service providers, because our service providers are actually the tool that we use to deliver these services. On the other hand, it will also increase our reporting. It will increase the information that we have to be able to make evidence-based decisions, to be able to improve the services that we offer, and also at the same time massively reduce fraud because of a record of all these transactions. And indeed, there are many transactions because we attend to almost 1 million patients a month. And as of last year, for the people who are active, we had over 5.8 million Kenyans that we paid for hospitalization. So this is something that we are working towards, and we need literally all hands on deck. But we know because of the sheer volume of transactions, because of the sheer size of the transactions, that we have to create a platform for transparency and accountability through digital platforms. And that is what we are driving, and that's what we're encouraging. So I'm urging you, in fact, I'm sure you've seen, we even have our apps, My NHIF app, we have our USSD code. So make sure you download My NHIF app and you'll be able to transact more easily.
Okay.
I know there were issues that were mentioned earlier about the capitation and hospitals getting proper capitation. But as of 3 months ago, to be able to have a hospital capitated, members have to choose that facility on their own using their devices or help from our 153 service points across the country. So we are working and edging towards this era where we have 100% transparency and accountability, but also using our digital platforms to be able to achieve that.
Okay, Dr. You have a minute to go. We have a minute to go before we wind up our conversation right here. In order to circle back to where we began this particular conversation, under the cloud of COVID-19, right now looking at the numbers standing at 70,000 across the country, November having, the peak in terms of deaths at 270 in 2 weeks. For a Kenyan who's watching this interview, looking at their NHIF card, and are worried that if they start exhibiting symptoms, really, this card won't help, what's your message to Kenyans right now? Because it is a key critical piece of concern right now.
It's actually, number one, there are protocols to minimize exposure. Jeff, if you do not get exposed, you're not going to get sick. So hand hygiene, masking up, physical distancing, avoiding crowds, and when sick, keeping away from people. So all these protocols to ensure that we contain the spread. That's number one. And that is very important to ensure that we also don't get those spikes in numbers that end up overwhelming our healthcare facilities. Number two, the national government as well as the counties have been on ensuring that the capacity in the facilities is improved. Issues about the beds and the organization, issues about oxygen at the facilities, issues about PPEs, and I think there'll also be more talk about that today. So all these factors, and then at the end of it, for the folk who would have also to go to the now in that place now, you see the cost now would depending on the level that you access. My message is that we adhere to the, and at the same time, we'll continue supporting and ensuring and supporting in terms of ensuring that our people have access the care that they need. Efforts are ongoing.
Okay, Dr. Ariel, just hold on to you for a second. Don't go too far. We'll be back with you after the break right here. Don't go too far. So what we want to do is take a short commercial break at this particular point in time. When you come back, if you have questions, this is a good time to forward them to Dr. Camuno. He's the CEO of the NHIF. Any questions you have, send them to us on the WhatsApp number. You can also get me at I am Jeff Morton. Short break, back with more. Welcome back. This is K24 this morning, of course, in conversation with NHIF CEO, Dr. Peter Camuno, talking about the pertinent issues, of course, of health insurance, more so now during the COVID-19 pandemic. If you have any questions,